Our project is on toxic shock syndrome. TSS is a cluster of symptoms that occur from an immune response to bacterial infections that are releasing toxins into the bloodstream, which then spread the toxins to other organs. It occurs when bacteria enter through a compromised area, such as an open wound or mucous membrane. Common causes occur from post-surgical wounds, childbirth, burns, use of a prosthetic device, menstrual sponges, diaphragms, cervical caps, etc. TSS can be life-threatening if not treated. Other risk factors include being over 65 years old, recent surgery, viral infection that causes sores or blisters, alcohol abuse disorder, and diabetes. The first case of TSS was described in 1978 in a small group of children. It gained more attention in the early 1980s following a series of deaths of several young women who used superabsorbent tampons. They used a certain brand of tampons made of polyacrylate rayon and polyester foam, which were highly absorbent materials that were obviously effective, so women kept them in longer, promoting bacterial growth. By the end of the 1980s, the CDC announced tampons as a risk factor for TSS, and the FDA required labeling on all the tampon boxes. Due to the changes in tampon manufacturing and the labeling, the number of cases went down drastically. This is just a good chart that describes the history of the cases and how the number of cases went down after the labeling and the absorbency lowered. 1/3 of those diagnosed are females under the age of 19, and as you can see in the chart, most cases are menstrual, but not all of them. In addition, there's a 30% risk of reoccurrence in people who have had TSS before. Finally, this ties into problems that we're facing today with COVID-19. In an urgent alert from North Central London Clinical Commissioning Group and the Pediatric Intensive Care Society, they reported that there has been an apparent rise in the number of children of all ages presenting with multi-system inflammatory state requiring intensive care across London and other regions of the UK. The cases have overlapping features of TSS and atypical Kawasaki disease, with blood parameters consistent with severe COVID-19 in children.
Okay, so there are 3 pathogens that cause TSS, and the first one and the most common one is Staphylococcus aureus. So how it infects, so Staphylococcus aureus produces certain exotoxins like pyrogenic toxins, superantigens, and hemolysins. A specific type of pyrogenic toxin superantigens is toxic shock syndrome toxin 1, or TSST1. And this is a protein, and they are able to penetrate mucosal barriers and exhibit lethal activity, pyrogenicity, and superantigenicity. Hemolysins include alpha, beta, gamma, and delta, and their function includes converting local host tissues into nutrients required for bacterial growth. These exotoxins bind to molecules on antigen-presenting cells and T cells, which therefore triggers a cytokine storm. So these exotoxins make up about 75% of all TSS cases. And then secondly, enterotoxins make up about 25% of all TSS cases, and their primary function is to inhibit the host immune response to Staphylococcus aureus. So this picture right here on the bottom just shows how the toxins enter into the tissues. So for signs and symptoms, staphylococcal TSS is characterized by sudden onset fever, chills, vomiting, diarrhea, extremely low blood pressure, mental confusion, and a severe sunburn-like rash. So this is the rash up here, and you can see the cracking of the skin, which indicates how severe it is. And staphylococcal TSS is fatal up to 50% if left untreated because the blood pressure falls so low that the brain, heart, and other vital organs have an inadequate supply of oxygen. So this is shock, and that's where TSS gets its name. Okay, for diagnosis, so diagnosis is typically just based on signs and symptoms, particularly in menstruating women. So cultures of blood samples will grow colonies of Staphylococcus aureus. For treatment, so to start, you're gonna remove the foreign material. So this could be a tampon, sponge, diaphragm, or nasal packing. So nasal packing, if you have a bloody nose, you want to take that out. drainage of infected wounds, IV fluids to support the falling blood pressure. Dialysis might be needed if the kidneys are affected, and then antibiotics like nafcillin, oxacillin, and vancomycin are generally prescribed. There are also some newly approved drugs like oritavancin, tedazolid, or dalbavancin that also may help. Also, anti-TSST immunoglobulin can be prescribed to counteract the exotoxin, and corticosteroids may also be given to counteract the manifestations of shock. All right, and then finally, for prevention, avoiding the use of tampons, sponges, and birth control diaphragms, using fewer absorbent tampons, and then lastly, changing tampons more frequently.
Okay, so the second type of bacteria that can cause toxic shock syndrome is Streptococcus pyogenes genus. So just some background information about this bacteria. It's a gram-positive cocci bacteria that grows in chains. It causes other diseases like tonsillitis, scarlet fever, cellulitis, and rheumatic fever. It's typically causes an acute infection of soft tissues or pharyngitis, which is basically a sore throat. Most of these infections are self-resolving. It's when the bacteria moves into sterile sites of the body that toxic shock syndrome can occur. Naturally, this bacteria colonizes the skin and mucous membranes, and it's after some sort of abrasion that the bacteria releases virulence factors that allow it to enter and infect the body. Beta-lactamase inhibitors, such as penicillin, do work well in this bacteria. Something unique about this bacteria is that it exhibits beta hemolysis or complete hemolysis in a blood agar plate, and it uses streptolysin to do this. The fatality rate of this bacteria is between 30 and 70% when it causes toxic shock syndrome. So a lot of the symptoms are the same as the staphylococcal bacteria. But there's also organ system failure that includes from the kidneys, the liver, the lungs, and the blood. That also involves the cardiovascular system. It infects from endotoxins that are released from the bacteria, and the incubation period is usually between 24 and 48 hours, with the first symptom usually being hypotension. Diagnosis occurs based on the signs and symptoms, and if you can grow the bacteria on a blood agar plate. The initial symptoms are very broad, and it can also often be misdiagnosed because of this. And this is very rare also. A lot of doctors won't ever see a toxic shock syndrome from this bacteria. For treatment, hospitalization is required, and antibiotic therapy as soon as possible should be given. And that's subject to change depending on the patient's condition. Penicillin and clindamycin are usually the first antibiotics given, and that can, again, as I said, like be changed depending on what the patient needs, within 24 hours. Another form of treatment is removal of the infection site, and this can be done by surgery or like removing a tampon if that's where like the original infection is from. There have also been cases where people have had to have limbs amputated. And then prevention for this bacteria for toxic shock syndrome just includes things like good hand hygiene and respiratory etiquette, so washing your hands and covering your mouth when you sneeze or cough. Tampons should be used properly with the lowest absorbency and should be changed every 4 to 8 hours. If a person has had a severe infection with the Streptococcus pyogenes, they should avoid using tampons altogether. And antibiotics should be given to household members over 65 years old as a preventative measure, because it means that there is Streptococcus in the household, but only for people 65 years or older because they are at risk.
And the third and final bacteria that may cause toxic shock syndrome is Clostridium sordelli. Clostridium sordelli is an anaerobic gram-positive rod that is typically found in soil and sewage. While it's rarely found in humans, it can be part of the normal flora of the gastrointestinal tract and the vagina. infects by producing exotoxins that target the RAS guanosine triphosphate, binding these proteins and glycosylating them. Those most susceptible to this infection are menstruating women, women following pregnancy, this includes after a live birth, an induced abortion or spontaneous abortion, newborns who still have their umbilical stump, and those who use intravenous drugs. For example, the rate of colonization of Clostridium sordelli in the vagina of a non-pregnant woman can be from 5 to 10%, but following an abortion, it can be as high as 29%. The symptoms of this include nausea and vomiting, weakness and fatigue, flu-like symptoms but without a fever, pain in the abdomen, swelling, high red and white blood cell counts, and an increased heart rate. Some ways that this can be diagnosed is with a blood test to check the amount of red and white blood cells, and an endometrial biopsy to look for this bacteria in the uterus. And there are multiple ways to try and treat this infection, which include giving large doses of penicillin, clindamycin, and ciprofloxacin, as well as IV fluids and vasopressors. Depending on the case and severity, a hysterectomy may also need to be performed to remove all or part of the infected uterus. As of 2018, toxic shock syndrome due to Clostridium sordelli has a high mortality rate of 87.5%, but again, this is very rare and few people are actually diagnosed with it. So if you are experiencing any of these symptoms, you should probably go see a doctor. So yeah, like a headache and fever in some cases, and lethargy, vomiting, a rash, and diarrhea. And this is our works cited.
And that's it.